am Anna, and this is another episode of Community Connections airing on OROMIA11. Today's guest is Jetta, and she is here with Trellis and the Senior Linkage Line. We are talking all things insurance, Minnesota Care, as well as medical assistance. This is going to be important because we are sharing some special information about renewal dates and what your insurance coverage may look like. This is going to be an episode you won't want to miss. Stay tuned. Thank you for joining me today on this episode of Community Connections, Jetta.
Thank you. Glad to be here.
Absolutely. Can you introduce yourself and the work that you do with Trellis and the Senior Linkage Line?
My pleasure. My name is Jetta. I am the Volunteer and Outreach Manager at Trellis. Trellis is a nonprofit organization that serves older adults. So our mission is to assist individuals to age successfully and to develop the community to care for an aging population. And so Trellis has programs like pension rights. We work with memory care and Alzheimer's and dementia. We have a program of wellness and evidence-based programs to help people move and feel better about their lives. But the program that I work on is the Senior Linkage Line.
Okay.
The Senior Linkage Line is a free statewide service of the Minnesota Board on Aging. Trellis happens to be the area agency on aging for the Twin Cities. So we sit in close partnership with the state. It's a resource and referral system. People can call Monday through Friday, 8 to 4:30. Any question that someone has about aging, transportation, chores, nutrition, legal, any question that you might pop into your brain about, I wonder if they could answer that. You should test us and give us a call.
Absolutely. I think that's wonderful. She said you should test us.
You should test us.
Now, today we're talking about insurance.
Yeah.
Can we talk a little bit about what is Medicaid and what is Minnesota Care?
Sure. We're here today because the public health emergency has ended. In December, for the last 3 years, we've been sitting through a dark place in the world, in the United States, in Minnesota. And as of December of 2022, President Biden ended the public health emergency. What that meant is as of May 11th, we don't have any of the rules that we had in the past. So that means that Medicaid, which in Minnesota we call medical assistance, and also our Minnesota Care programs, we have to go back to the rules that we had in place before the pandemic. Every year we did renewals. Every year we had to determine if folks are eligible. So for folks who aren't familiar, Medicaid, which again in Minnesota we call medical assistance, is just the federal Medicaid program for Minnesotans who are low income.
Okay.
Now, Minnesota Care is for Minnesotans who are low income but don't have access to affordable health care insurance.
Okay. And can you talk to me a bit about the process for those that are not familiar about what that looks like?
The process in terms of eligibility?
Absolutely.
Right. So if an individual is lower income, they would typically engage with their county first, whichever county across Minnesota, the 87.
That's what I want.
And they would gain access. Sometimes they're in a homeless situation and they're going through a facility and they gain access to a case manager that gets it to the county. But eventually at the end of the day, they access with whatever county they're in. They determine what their assets and income are and to determine if they're eligible for these two insurance programs.
Okay, so with the public health crisis ending, what does the process now look like? What happens?
Right. Well, we've always, throughout the years, done an eligibility. So states haven't done this for 3 years, and we've had a lot more people come on the rolls, and counties haven't done this process for 3 years. Individuals who've gained access to this process, who've never had, a tumble with being low income or in poverty or whatnot, they're thrown into the system, and now we have to go through a renewal, and that's what we call the annual process of looking at eligibility for your income to determine if you're eligible. Because as government, we want to make sure our most vulnerable people are accessing. Not everyone, but folks who fall below a certain threshold are eligible. And that simply means that if you're on medical assistance, the Medicaid program, that everyone has an anniversary date. So yours might be in October, mine might be in July. And so every July now, we haven't done it for 3 years, we're going to go back to the process of a renewal process. And so that means that the counties are starting up their systems, firing those energy systems to reach out to individuals so that they could find the renewal and see if they're still eligible for the program.
So people are going to need to start reaching out and updating their information through the county if they are receiving assistance, so that everything can be current for the process of starting to re-enroll, right?
And what we know is that the pandemic was hard in so many ways, but people lost jobs. They moved in with their kids. They moved across town or across the country. And so the county had them in the system, and then life happened and they adapted. And now sometimes we're not able to find these folks. They may have moved a block away, but if they haven't updated that address, these individuals who may otherwise be eligible are going to lose eligibility. And what we know about people on medical assistance and Minnesota Care, these are the most vulnerable people in our society, and we need to do what we need as much as we can to make sure that we gain access or keep them eligible for these important programs.
I was watching a video about COVID long haulers, and people were saying, talking about pre-existing conditions. And, oftentimes we're like, nope, no pre-existing conditions. And the doctor stopped the woman and said, if you've had COVID, that's a pre-existing condition.
Ooh.
If you've been affected. And I said, I never thought about that.
Right.
And if you've had it more than once, that has
exponentially.
Yeah, that has changed your body's landscape, and now you need to reconsider. And I said, I don't know how many people thought about that until they heard that, or even think about that now. So when they're talking about re-enrollment or trying to find assistance right now, medical assistance of any kind, you now have to start thinking about what this means, not just in terms of, your own health, but what you can probably look at for a plan.
Right. Wow, I think we don't realize, we probably won't know for years to come the impact of what this global pandemic had on our world, but that's a perfect example of where we have to start thinking a little bit differently about our own medical care.
Absolutely. Let's talk a little bit about funding. How has the COVID-19 pandemic affected Medicare's funding?
Well, what we know in Minnesota, for instance, is that between March of 2020, when we kind of started this fun thing, and now 360,000 Minnesotans gained access to one of these two programs. 360,000 people are eligible now for medical assistance or Minnesota Care. So in terms of just the dollars, it's extraordinary. It's exorbitant. In Minnesota today, we know that 1.5 million Minnesotans are eligible for these two programs, and that represents 25%. 1 in 4 Minnesotans sit on these two programs. So the financial cost is incredible, exponential of what we're paying, and we received the funding from the federal government to start to pay for this because no one expected this to happen, and the government is stepping in to provide this assistance.
Has Medicare expanded its coverage for telehealth services due to COVID-19? And if so, how are underserved communities of color going to be impacted by this information?
Yeah. Well, the first part of your answer is absolutely. Medicare knew right away is relative, but we pivoted as government, and they started making some waivers to add video appointments and telephone appointments for individuals so that they could tap into that, which meant that our parents and individuals didn't have to go to the clinic because they were likely closed. They didn't have to wander out of their homes. They could actually take those calls, and whether it was a normal appointment, a medical appointment, or a mental health appointment, they could do that from the comfort of their home. Having said that, we know, we've talked before, that we have disparities in our culture, and those individuals who have a smartphone, those individuals who have the financial wherewithal to pay for internet and Wi-Fi in their home, they had a device, they were able to access that. What we also know is that as we age, using technology is hard. I cannot tell you how many times I received a call from home from mama saying, I can't do this. And so we figured out how, from distance across states, to make that happen. When we bring in the factor of individuals who are lower income and communities of color, if you didn't have a tablet, if you didn't have a resource, you didn't have the Wi-Fi, they used to go to McDonald's to pick up Wi-Fi. We used to go to schools to pick up Wi-Fi. We used to pick up the county building or a library. Well, these were all closed. And so we have disparities in Minnesota right now with regard to the mainstream and communities of color. COVID expanded it. And so it's a reality that we kind of have to own, and you have to talk about and realize that this COVID didn't treat people the same.
Absolutely. I was thinking when you were just talking about a tablet or a phone, when everything went to doing telehealth or doing things on Zoom, right? Trying to navigate that and seeing the pictures of kids sitting outside of their schools in the parking lot, trying to do that.
Right.
But we're coming up on summer.
Right.
And so that means schools are requiring that materials are being turned back in. So the computer you may have had, the tablet you may have had,
Right.
how are you able to then get on, or, you know what I mean, have access to something like that, telehealth services, or to do any type of appointment if you don't have something like that in the home. And if you may or may not, due to the cost of living now, you may not have the same phone provider or phone you've had in the past.
Absolutely.
How are people then supposed to be able to connect to try to do these, to receive these resources?
Well, we know that a percentage of the population, when that technology is taken away because of a school, for instance, they are going to lose the ability to dial into the community. I think it's a greater public policy issue of as policy leaders on the county and the state and the federal government to realize the gaps in services. I think that the silver lining of COVID is it's shown a light really brightly on the problems that we have and expanded it.
Yeah.
So, I mean, I think it's an opportunity for the brightest and best among us to say, this is the problem, this is the issue, and how do we solve it for the least among us? Because if we solve it for the least among us, then those who have are closer to those who have not.
Absolutely. What does the timeline look like for folks that are trying to renew their coverage?
Right. This is a complicated question and an easy question. So we'll take Minnesota Care first.
Okay.
So Minnesota Care is the program for Minnesotans who are low income, who don't have that access. The nice program for this is in October of this year. October, November, and December is when the state of Minnesota will do those renewals. And so we'll do the fourth quarter of the year, and eligibility for Minnesota Care will start January 1st. So if people are listening in and they have Minnesota Care, they can have a good summer, they can relax, they can say it's going to come, and they need to just wait for that, and the caseworker, the county, will reach out to them. That's the easy one. The more difficult one is medical assistance. It's a far greater program, and we have hundreds of thousands of people every month gaining accessibility. For instance, like I said, my eligibility month may be July. If my eligibility is in July, the county where I live will start 3 months prior. So in April and May and June, they're going to start reaching out to me. They're going to start sending letters, probably a couple of them saying first, hey, it's coming. Right. And then the next one will be, okay, start getting your paperwork together, and then the renewal packet will eventually hit. For those individuals that we talked about who have moved during COVID, who aren't found, the county's going to try to reach out, and they're not going to be able to reach them. And those are the folks that we're trying to get to their family members, to their neighbors, to people at church, to help them figure out how to do this. I talked to some folks at an event recently at a senior center in Minneapolis, and one of the women said, I got a text. I said, you did? I got a text from my county. I'm like, go county, right? So in the system, if someone has their cell phone on file, the county will send out that and say, okay, your renewal date is in November, and then your renewal date is in January. And so if you're not getting communication right now from the county, you can actually go online, you can talk to the county. Some people are affiliated with the sovereign tribes. You can go there, you can call the senior linkage line, but we need to have some point of entry with the county or your private health insurance just to make sure, yep, this is my address, this is my cell phone, so that you can have some peace of mind when that renewal comes, that you're not going to be left behind. Because we know that there are people, Anna, that because of COVID, you know, they gain accessibility, and we didn't kick anyone off during the pandemic, which is the good thing for government. But now we're going to go back to those renewals, and those individuals who go over income, there's going to be a certain point of those people who are going to lose eligibility.
Okay.
Again, we maintain these two programs for individuals who are the least among us and the most vulnerable and the least income. So we know some people will lose eligibility, but then there's two groups of people left. The people who are eligible for the program and they're automatically renewed because their addresses are updated and their phone numbers, they can take a rest. And then you've got this group where we're worried about. These are individuals who are still maintaining eligibility. They're still low enough income to gain access to medical assistance, but they've moved. Or there's a language barrier, right? Because that, I don't know about you, but when that envelope comes in the mail, at some of the envelopes, I'm like, I don't want that one. That gives me stress. That's a bill, whatever. This envelope is going to come to the mail, and I think the strongest message we can make is that when that envelope comes, and the counties through the state of Minnesota, it's going to be a big old blue dot. right? And that's as racy as they decided to go, Anna. It's going to say important information enclosed. And so when you get this, the tagline they use is when it's time to renew, look for the blue, right? And so this little blue circle, for those who are colorblind, it's a dark circle and it says important information. Open it up and it'll say, we've got information, here's your renewal, and we need more information, or, you're going to be automatically renewed. And I have a relative, when he gets mail, he just chucks it. He just doesn't look at it.
I was just about to say, so many of us are just like...
Right. I mean, we're exhausted. 3 years of this, I just need to go in the corner and take a nap.
Right. The bills don't stop.
They do not stop. This is one when that blue dot arrives from your county, to open it and just look at it. And for those of us who may be caring for, I care for my grandmother, I've got my parents in my wheelhouse. Mm-hmm. If you are caring for someone as a family member or a neighbor or whatever the relationship, if you've got love in your heart for someone, start asking questions, start going through. My grandmother doesn't speak English, and so I go over and I'm looking for the mail, and I'm looking for that one because I need her to continue the eligibility for MA, medical assistance, so she doesn't lose it for our family.
Now, outside of checking the mail, what else can we do to make sure that we are able to receive are able to receive the renewal for our medical assistance?
Right. People who are proactive can go on the state websites, and it's mn.gov/DHS/renew my coverage. When you go on that platform, Renew My Coverage, it'll have options for dialing in. If you have your member number and your case number, not everyone does, but if you're that person, you can go in and go, oh, I'm August, right? I can relax for a little bit, or I'm January. You can do that on behalf of a family member if you have access to the member number and the case number. Okay. But some people, they're not equipped. They don't have what it takes. And I would say if you're not able to reach out to your health insurance company, the back of your card has the customer service on it. You can't get to the county and you're stressed about it. Folks can call the senior linkage line, which is where we work with, and it's one of those places where any question is a good question. We will comfort you. You'll feel like you're leaving with a cup of tea in your hand. We can help you weave through some of the problems. And so if you've got any stress, that senior linkage line is a place to start for folks.
This is our opportunity to test the senior linkage, just like she said.
That's right.
Now, is there a difference in the renewal process for people that have received Minnesota Care and or medical assistance?
Yeah, slightly different. I mean, it's really the timeline. We're still going to go through the renewal. We're still going to look at what is your income. They may look for proof like a pay stub. They're going to looking for proof from a federal tax document. Some people have jobs off the books, and they might have a check from someone. Keeping those types of things kind of handy, knowing that it's going to come, is an important piece. But it's just timeline. For folks in Minnesota Care, their process is going to be October, November, December, with a start date of all coverage starting January 1st. Okay. For those who are on medical assistance, it's that rolling monthly piece where you don't know. I mean, there is a 1% of people out there to say, I'm a September renewal, and I know I have to do this in September because I've been doing it for 10 years. Mm-hmm. The rest of the population, the 99% of us, are like,
we don't know.
We don't know. Right. So you can get ready by gathering your proof documents for your resources, and then going on the mn.gov/DHS/renew my coverage, and just dialing in to see where that is. You could actually reach out to the county. Like we walk in, and it's harder that way because they're really built for online these days, and you'll be waiting online for a lot of time. So you kind of make your choices of how you want to dial in. But I would say that ignoring the problem, I mean, it's a strategy. It's just not a good one.
Yeah. I think that's a word for a lot of different things in life. If there was an encouragement that you could give to somebody that says, you know what, this is really daunting, it feels very overwhelming. I may have had a daughter, or I may have had a caregiver that's helped me navigate this. I don't have that anymore. Mm-hmm. What is an encouragement or something that you would like to provide them to get them interested in not only starting to either check the website or getting their documents together, or actually opening that envelope that they're going to send to me?
I think that might be the easiest one is, this entire process has been a learning process for all of us. It's been hard and dark, but there's been so many moments where people in your life have surprised us. You know, meals on the doorstep or sidewalk chalk in front of my house by small little girls. There are people out that love you and will care for you. If you'll take one step forward to doing this, opening that mail may be the one step. Calling the senior linkage line may be the next step. Take one opportunity. You will be surprised by what you get. The senior linkage line is designed for folks who may not understand what's going on, may have no information, no access to technology, and they're like, I'm not doing that. And we will say, welcome. Let's see what we can unweave for you today to make today a better day than yesterday.
That's wonderful. Thank you for joining me on another episode of Community Connections.
Absolutely, my pleasure. Thanks for having me.
Unfortunately, that is all the time that we have for this episode of Community Connections. A very special thank you to the team over at Trellis and the wonderful people at the Senior Linkage Line. Be sure to give them a call if you guys have any questions regarding insurance and/or helping a loved one navigate the upcoming changes with medical assistance. As always, I am Anna Orr. This has been an episode of Community Connections, and I look forward to connecting again with you soon.